Hi, Anne. Welcome to our What podcast for Canada Coach Academy. It's such a pleasure to have you here today.
Well, my pleasure, totally, Natalie. So thank you for having me. I'm excited about today.
Great. Well, and I think the timing is so good for this conversation given your profession. So I'd love for you to tell people what you think is important for them to know about you, and then we'll get into it.
Great. So I am in the health field. I've been a physician for 30 years in healthcare as an academic physician. I'm a pediatrician, but I also have a fellowship in child psychiatry.
Hmm.
And I have a huge academic portfolio, but clinically I deal with child maltreatment. And so I do a lot of trauma work
Mm.
around for children and adolescents. And in addition to that, in my academic work, I do work in professionalism,
Mm.
which is quite related in the coaching world. And really, what led me here to coaching is through my professionalism work. So it's amazing how we come sometimes full circle through different things that we do in our life that bring us to a certain point.
Well, and for myself and also maybe people listening, how would you define professionalism in healthcare? Like, what would that focus be for you?
Yeah, so for us in professionalism, we recognize that we are professionals. So if you have a profession, a skill, and expertise, you are considered a professional. And there are certain expectations of professionals. And so in the field of medicine, we have a code of ethics. There are expectations by our professional colleges of how we act, how we are to behave. Within our hospital systems, there are codes with regard to human rights and equity, and there are expectations of degrees of civility. And so you can imagine how in this era that we're at after COVID and the challenges in the healthcare system, that different aspects are impacting on the individual as well as on the institutions that are leading to dis-ease in our healthcare professionals.
Yeah. Yeah. I you know, well, I don't even know where to start because it's such a great, place to explore. I Before the holidays, I had to stay in emergency overnight, which is something that was a bit like surprising. But what I was noticing more than ever, being like where I was positioned in emergency, I just had to sit there on an IV for a long time. And I was watching the stress and the intensity of that, like I can't imagine working in that every day, and the pressures that I think must come with that position. So I'm just appreciating, how much we've put onto the healthcare system, how much stress and strain we've put on to our system, and wondering, with your experience and of, having, recently graduated from the Canada Coach Academy, just wondering about what are you seeing as the opportunities, or, what's emerged for you since taking the coaching program?
Mm. Well, a lot has emerged for me. And first of all, I'm sorry you had to visit the emergency department
No, it was
because
nothing.
because we hate to, we always want to stay away and keep healthy.
Hmm.
But what I would say is, as you look around in healthcare, you really appreciate, you've mentioned the stress and the strain.
Yeah.
And um, what I would say is, with decrease in limited resources, with increased acuity of illnesses,
Yeah.
with decreased staffing, subsequent to consequences of COVID, and uh, what I would say is personal as well as professional strain that has occurred,
Mm.
that individuals have huge weights. And that, I think, is what's leading to some of the burnout that we're seeing in individuals within the healthcare system. And also that direction that people want to leave the healthcare system.
Yeah.
And surprisingly, today in the newspaper, what do I see as a headline? 79% of healthcare workers are disillusioned with the government and do not believe that the government is going to actually improve the healthcare system, which is leading to something like 62% of individuals who are actually exhausted. So if you have these exhausted healthcare professionals in our system, you know, what is the outcome on patient care? Because I do strongly believe that when I look at my colleagues in healthcare, they care deeply about their patients. They want to do well by their patients. However, when you're overworked with very little resources and supports in place, and then you don't feel valued, and you can't achieve the goals that you hoped to achieve, then you have the recipe for burnout. And I do believe that I see that amongst my colleagues. And that's my concern. And there's the role for coaching. There is the ticket for coaching. And I really see coaching as a tool, as an option for transformation, for building compassion, for building collaborations, and giving people purpose. Once you feel that individual purpose and can build those collaborations, I believe you can have joy. And that's what we want. We want to have joy in this life, in particular.
Wouldn't that be
Doing.
Yeah. Well, you know, it's resonating so much. I don't know if you know that my work in my master's program, my dissertation is on teacher as coach. And I've had an opportunity to run a pilot. And the system is very interestingly similar to what you're facing in the restrictions that prevent, like the system prevents the changes from happening because the goals of the system are not aligned with what's important. Like where we think, you know, like for the school system, it's if the objective is to graduate as many students as possible, then you can't have that objective and still fulfill this other, you know, approach of creating a classroom that's more inclusive and more individualized education and spending more time with students and being more taking a more coach approach because it doesn't fit the goal of the system. And so in our healthcare, like I was talking to my brother-in-law who's a surgeon, he's on call at a hospital locally and he has his private practice. And he said, if he doesn't see a certain amount of patients in one day or hour, whatever it is, he doesn't get paid or he's not paid enough. And so this, you know, 15-minute time slots are what we have to deal with, right? And, you know, in education, it's always about there's not enough time, there's not enough resources. So how do we break through these challenges and obstacles that seem to be very real and in our way?
I think you hit it right there, Nathalie, when you talk about what we value. Because many hospitals and academic centers have their value systems, their value statements, right? They're well outlined. However, that is what's written, but that's not necessarily what is practiced. Right. Or that's not necessarily what drives the engine. So there are lovely statements, but they're not living by those statements. And what becomes very evident are financial constraints. Reaching, you know, we have budgetary, and those are realistic, and I'm not poo-pooing that. I recognize that. However, when we are driven by the finances and we are not driven by, you know, that quality of care, the actual, can we promote health and not just be sick model focused? Is there, many systems don't have even finances put towards the promotion of health and prevention. It's all towards intervention. So I think we got to get our head around, what do we really value here? And we all have to be on the same page and bring it back to that and then grow from there of, okay, so if that's our value system, then what's our goal?
Mm.
What's our big goal? But what are, right? What are our effective goals and what's our end goal here? And that's where coaching comes in.
Yeah, and I was, I recently, well, I just finished a course on grief, and it was so interesting to me how often the opportunity for coaching came up in the articles and research. Going back to the like late 60s, Elizabeth Kubler-Ross and her work, and even at that time, she was noticing an opportunity for, a different way of conversing with patients, a different way of connecting and getting to know with her interviews. But that was just even touching the surface, although she raised the need at the time for more medical training that revolves around connecting to people. How do we, and it's the same thing, I think, in organizations. When someone is really good, a subject matter expertise, right? We often think that those people are the best managers. But in fact, they may know the subject very well, but they don't know how to connect with other people. And that's what we call that soft skill, right? That we love to throw around. And I think the same with, doctors. We teach them and we take so much time to make sure they have an expertise, but we forget that they're dealing with people and humans who have feelings and emotions and a need and fear. How many people are so afraid when they go to see a doctor, right? That fear is so real. So, like, what can you say about that whole, soft skill versus expertise approach in medical training?
So one of the things that I think is important for listeners to understand, that there was this great child psychiatrist by the name of Dr. Dan Offord,
Mhm.
and he had a practice here in Hamilton, big researcher, he received the Order of Canada. But in one of his studies, he determined that the most important therapeutic perspective for a child is to have one key relationship. If you have one key relationship with someone,
Mm.
that the prognosis for that, for your well-being, for your mental health, someone who is there beside you, whether, through thick and thin, but believes in you, that the outcomes are much better for those individuals.
Mm.
And I say that because you talk about connectiveness.
Mm.
And so when we talk about those soft skills in medicine, I am not dismissing that we absolutely have to have the technical skills. We have to have the knowledge and the technical skills. But if we're not, we also have to know our limitations, and we need to be able to ask for help, right? So I may not know everything, but I know when to ask for help, then I'm good. But if
Mhm.
I cannot connect with you as a patient, no matter how good I might be technically or how knowledgeable I am, but you will not have trust. And if you do not have trust, you're not going to follow or anything that I might prescribe or engage with me or actually move forward. And so that's the essence of the doctor-patient relationship, is that trust. And it's in a collaborative process where I listen to you and I understand your needs. And I don't just tell you what you need, but I think about it in the context of who you are in your life. And how is this going to work? And I can certainly give you what the evidence is and what might be helpful, but we're going to work together to figure out, how will this work for you, so that A, you can be as successful and achieve the health that you want, right? But that'll never happen if we don't have a trusting relationship where we have a conversation, and it doesn't take a lot of time. And
Mhm.
so we have to demystify that building trust takes a lot of time, or having that collaboration takes a lot of time. But
Yeah.
you have to be present.
Yeah, present is the key, right?
In the moment, then, there, and you need to be paying attention, not just to what the person is saying, but their body language,
Mhm.
and be reflective of that and notice things and question and ask them about that. And that demonstrates not just that you're interested, but you're interested because you want the best interest of the person in front of you.
Yeah, I mean, it's so important what you're saying, and I think what I really appreciate about the coaching profession, or what I do, is the opportunity to show people, like what you said, that demystify that trust takes time. If we show up and be present and use skills to be present, that can really reduce the amount of time, obviously, that trust takes to build between two people. But it's also, I think it's as important of a skill as the expertise that you're learning, because like what you said, if you don't have trust, you don't have anything. The patient's not going to open up, they're going to leave things out, they're going to feel like they don't matter, they're not important, they're not going to reveal maybe some very important aspects of their health that a doctor needs to know to provide the care that, this person needs. And I just wonder, where do you see an opportunity for change? Like, what stands out for you?
So I would think about it in a number of areas. So I would think about it from an individual level, from an organizational level, or even before the organizational kind of community, and then an organizational level and a higher level, even perhaps in a community level. And what I would say is that on an individual level, um, that we as healthcare professionals need to be very cognizant and be self-aware. And we need to pay attention to when we are feeling that cynicism develop, when
Mm,
we're feeling more removed, disengaged. And we need to understand that just because you're in healthcare doesn't mean that you don't get depressed or anxious
mhm,
or all those other things, and make sure that you are addressing those issues or getting your needs met. Because if you don't do that, then it will be very hard for you to actually be present and attend to the needs of someone else. And then I would see that within our teams, so that community of our teams, that small little community of our teams, that we need to collaborate with each other and we need to support each other, pay attention. And when you see that something is not right with someone, to be available to them, sit down with them, have coffee with them, tell them that you care, right? That you notice something. How can I be helpful? And be present with them.
mm,
And then I think, and also be helpful. So if they need help with something, be available, because we don't all know everything, and be okay to say, well, you know what? I also goof up and sometimes I don't know it all and I could use your help as well, right? So working together.
mm.
And then I would say from an organizational level is really playing out those values in your actions. So if you value your people, how do you put the money there? Or where do you put your money? Like how is that? How do you demonstrate that? If uh, if you value patient care, then do you have enough staffing available? Uh, are you sure that you have can you make the environment a bit more confidential or safe, especially psychologically safe for people,
Mhm, mhm,
right?
mhm. Yeah.
And and I think governments also need to think about, we're putting a huge investment here into our healthcare system. So let's have a quality system. So let's put some money into prevention.
Mhm,
Let's um, take a look at, where are the areas in healthcare, where are the most vulnerable populations? How can we support those? We have a wonderful public system. Let's boost our public health system rather than think about privatization so that all can have access to this healthcare system.
Mhm.
And let's get all these groups together and have these conversations and be on the same page. And I think then we can move forward.
Mm. Well, I want to circle back to your comments on prevention, because I think for me that really aligns with a coach mindset, which is to take ownership and responsibility of our impact. When I think about prevention, I think about, empowering people to take more control over their health, but also be responsible for their health. If if we're going to abuse our health, the system will be abused because we will need it more, right? So people who can take care of themselves and prioritize health, I think that that's one place to start. And I like coaching for that, because coaching is a place where people, I mean, if we're coaching, anyway, from the paradigm that I have developed and grown at the academy, it's about ownership, responsibility of impact, evoking awareness, and knowing the difference between intention and impact. And this, we live in a world, like I've been exploring podcasts all this holiday, brain health, heart health, blood health, like all these things I'm just taking in, and I love it. And I'm excited. I just got off a 36-hour fast and I feel great. I wonder if there's a way to use the public, like these resources that we have that are so accessible to people, to help that prevention, and to maybe, I don't know, what's the role of coaching for you? Like, you came to a coaching program. What was the draw for you, and what have you taken from it as an individual? Because I also can tell you that I've had calls from residents in training who are burnt out and who are looking for a way to self-coach through those burnout and that challenge and that stress. What have you taken from coaching that can help you as an individual, but then also pay it forward?
One of the big things is the mindset. Recognizing that coaching is really a positive mindset because we're moving forward.
Mhm.
And what I would say is having that positive mindset and that coaching mindset, which is one of lifelong learning, one of curiosity, one of goal setting, and therefore you're achieving things. And when you achieve that, there's hope and there's joy because you've come to some realization that you have the capacity and you can do things, and that builds your own self-esteem. And there is a contagion with that when you have that. Just like there's on the other side, on the dark side, there's a contagion with burnout, right? So there is this contagion. And so I think the package of coaching, it really brought things together for me, who I was doing professionalism coaching for trainees. And these were usually individuals who got into trouble for some reason, some aspects of incivility. And these were good people who, either misinterpreted cues, or they were overwhelmed and they took a shortcut and got their hands slapped. But good people. And what I recognized was I had been doing therapy for a number of years, and I really appreciate the difference between engaging in a therapeutic relationship with someone. And also, I've done mentoring for years. I understand now the difference between mentoring and coaching.
Mm.
And that ability to shift someone is really remarkable. And so I came into this thinking, I'm doing this professionalism coaching, but I've never actually learned about coaching.
Mm-hmm.
And so for me, it was a great journey of thinking about, the therapy, the mentorship, the coaching, and how does this all fit in with the work that I do? And I've been able to use it in some of my therapy patients. And I've been using it, of course, when I'm coaching. I feel like I am much, I can offer the individuals who come to me so much more than I did before.
Mm.
And I have more aha moments with the individuals who I am coaching. And I see that they are moving forward and they're feeling more positive. And their reflection to me is this sense of accountability to themselves.
Mm.
And there's something wonderful about that. So I really, really see the value, and I believe that a progressive department in medicine would insist that all their new hire on physicians all have to engage, like a mandatory coaching relationship almost, because it is overwhelming when you come into, for example, into an academic center and all the expectations needed of you. And the anxiety when you've just finished your residency or your fellowship. So you have all this knowledge, but you don't know systems issues, and now you're all alone because before somebody else was responsible, but now you are fully responsible. And so I see that coaching can be so helpful in moving people forward, building their confidence, and helping them because many of them have goals, but they don't know how to achieve that, or they have so much resistance from other systems that they're not moving forward, and then they feel worse about themselves.
Mm.
And so it's helping them to get to that end goal. And most of them really don't have resistance. They're willing to put the work into it. Um, and then I think that that's the way that we actually rebuild our healthcare system with the healthcare professionals who are already in it, because we're supporting them to feel better about themselves and their goals and achieving their goals, which brings success. And it's a win-win for everybody. It's win for the individual, for their organization, and for the community as a whole.
Yeah, you're reminding me of the book. I think it's the Happiness Project by Sean Anker, where he's, happiness equals progress,
Mhm.
and progress towards what we want, not what we don't want, right? So that intention setting that you're talking about, and that ability to set goals. But, when we say set goals, a lot of people don't actually really dig into what that goal is. It's a very broad or very, maybe even out of reach goal that needs more work. And I think that the coaching that, a coach who can sit with someone and help them to articulate what it is, what will be different when you have that, and what's the measure of success, and what happens if you don't go for it, what are you giving up, right? That whole conversation can help people really step into the experiences they want, and like you said, protect their confidence as they move towards small steps, as they move towards what they want. So when we think about progress, what's next for you in terms of coaching, in terms of what you're doing with coaching? And I also want to say that I actually feel teary when I hear you talk about your work, because it's so important, and that you are paying it forward this way is my dream. This is why the Academy exists. It's to multiply the impact of coaching through the ripple effect that all the coaches who graduate, make in the world. And your work is just, it touches my heart to know that you're doing this, and you've taken this practice, and you've seen the value in it, and you're applying it. It's wonderful to hear.
Well, Natalie, it's kudos to what you've established, because the Canadian Coaching Academy is an environment that really supports its students.
Mm.
no matter where you are, emphasizes the things that are really important and builds those collaborations, builds that community. And with that, people can, prosper. And it really has opened my eyes to possibilities. Even as you were talking about goal setting, the amount of time and the energy and the efforts and the amount of specific sessions you have towards establishing goals and how hard that is. And people might say, oh, what's that all about? Oh, it doesn't seem like it's very hard. No, it's very hard. It's hard for people to actually be very clear about their goal. But as a coach, we work really hard to get them to that point of where they are clear about their goals. So I really kudos. I am thrilled. It's been a phenomenal ride, and it's not over, and it continues. And I'm so privileged and blessed to be part of the community. And that has really opened my eyes and my learning, just blossom my learning to want to learn more and want to do more.
Mm.
And the hard part, I think, is to get institutional buy-in,
Mhm.
help institutions understand that, wow, you have these people within your institution who are developing the skills, use them, use them. And my goal is to make my practice one now of where I can be a supportive coach, do that professional and leadership coaching for my colleagues. Because I've been in this profession for over 30 years and I understand some of those challenges. And my hope is to empower the people who are coming up the field so that they can have a long and really meaningful career and that their patients can actually be blessed by the skills that they bring to them so that everyone can get to better health. And so for me, that if I could do more of that, and I think if our institutions would truly value that and bring that forward, then that would be, I would feel like I would leave a good legacy
Mm. Mhm.
in the institution, right? Because my legacy with each patient is one with that individual at that point in time with them.
Mhm.
No matter how small, if I helped one person, I am thrilled. Then, you've had a life worth living, right?
Mhm.
And then, as a teacher, as a collaborator and a team member, now I feel like I really want to support my colleagues as they move forward because there is a lot of suffering. And if they suffer less, then I think everyone suffers less.
Mhm. Mhm. Yeah, and I wonder, if maybe the way to influence change and to, is like what I've noticed. People come to the program because they've been coached and enjoyed the experience. They come to the program to learn how to be a coach. And I can honestly say, I don't know if there's anyone that leaves the program that says they aren't changed in some way. And and it's different for everybody, and it's meaningful to each person, and it could be smaller, it could be big, but it's a change, right, that is profound for them often, and then impacts the way that they are with others. And I wonder so if it's just about appealing to the higher ups and of all the the leadership, and saying, get into a coaching program and experience this for yourself, so that how to, I was reading this article about, I can't remember what it was called, but it was about residents who are learning to, emergency situations. And this article was about this one situation where a patient dies, and you know, there's another emergency down the hall, and they basically drop everything and run down the hall, and there's no, and so the person writing the article is saying, I only later, after that day was over, did I realize that we lost a life. Like there was no connection to the humanity of the situation because they were so deep into the learning and the emergency of it. And at the end of the article, the doctor says, if only we could implicate even just a moment of silence for every lost life, you know, something to connect us to the humanity of what just happened. We know we don't have a lot of time. We know that they're emergency situations, but if there's just one opportunity to recognize, and I think that's what really, that to me is what coaching is about. It's to recognize that every person matters, needs to be heard, and needs to be seen, even if it's for a single second in that end of life, right? It's an interesting dilemma, and it's sad in many ways, but I think because of people like you and other people that I've seen in our programs who are part of that, you know, community of medical professionals, I feel like there's definitely an opportunity for change, and I'm grateful for, you know, that you chose us, and that you chose to pursue and further, and even just your curiosity about, well, what is coaching, right? I know a lot of companies create coaching roles, and then they don't give their coaches any tools, right? They don't give them training or even knowledge of what is coaching compared to mentoring, as you said, or even advising or consulting or supervision. Like, what's the difference? So just your curiosity is a great place to start as well.
And that is an important aspect, Natalie, that people need to understand that coaching is a profession.
Yeah.
With a code of ethics. And it is a skill set, and it has a technical perspective to it, but a huge humanity perspective that we can't live without. And putting that on the map, that recognition is so very, very important. And your rippling is contagious, and it's going throughout Canada. And I think that it's imperative, but the waves are getting bigger, and I'm happy to see that, as it should. And I think that it has the power as a tool to make change, right? And we need all the tools in our toolbox as possible to lead to change. And yeah, and it has an effect not just on the individual, but on an institution. And so we're very worthwhile, very, very worthwhile endeavor. So thank you for the experience. Thank you for the wonderful leaders that you have at the Canadian Coach Academy. I am thrilled that I have had a great group that I worked with, and we still connect with each other. And I know those collaborations are so important, the community of practice. And I am excited about the future. And I'm excited about doing more. And I want to continue to be a lifelong learner. And keep going. And I believe there's a lot of hope and a lot more joy to spread as we're entering this new year. So that's my hope as we move forward.
Joy is a wonderful thing to bring into the new year. I think that's a worthy cause. Well, I just want to say thank you so much for taking the time, and it's been such a pleasure to get to know you. And also, again, just I have the utmost respect for what you're doing, and I hope that you continue to bring that curiosity to all aspects of the work that you do, because I really feel like that's a blessing and a gift for others. So yeah, thank you so much for this time.
Totally my pleasure. Thank you so much, Nathalie.